Hello, this is Dr. Laura Tigler. Welcome to my channel. This channel is meant to provide good general medical information. It's not meant to provide specific medical advice. Please do see your primary care provider or your primary care doctor to obtain medical advice that's tailored specifically for your needs. At the end of the medical information, I am going to give some spiritual information. If you don't want to see that portion of the video, I will let you know once the medical information portion is finished. And at that point, you can click away. But first, please do like and subscribe. So today's topic is sleep apnea. I did get a request about sleep apnea during that atrial fibrillation talking to an expert video. So today we're going to go over some basics about sleep apnea. And as promised, I am going to show you some pictures. So on this right-hand side, you'll see an open airway. And you can see that air is flowing through the nose, back behind the nasal passages, down into the trachea, which is in the front here. This back portion here is the esophagus. And then the mouth may or may not be open during sleep, and it too can entrain or suck in some airflow. And it can be sucked down behind the tongue there. This is the tongue. And it too can be sucked into the trachea or the airway. This you'll see is called the uvula. It's that large, or maybe somewhat large, tissue that hangs in the center in the back of your throat. It's pinkish. If you have a significant other or children or someone else in the household, you can ask them to open their mouth and say ah, and you'll see this pink soft tissue hanging down the middle in the back of the throat. This word here is tongue in case you can't see it. And as I said, this large tissue here is the tongue. When we're sleeping, it tends to fall backward and it can block the airway. And we'll go over that in a moment. This word here is pharynx, if you can't see that word. And that just technically means the back of the throat. So when we have pharyngitis, it means infection or inflammation in the back of the throat. And then this word here, actually words, is open airway, and it's just showing, yes, indeed, this airway here is open and air is flowing from the nose downward and may or may not be flowing through the mouth. Okay, so now let's go to the abnormal picture. And this picture says obstructed airway. So there are many different types of apnea, both in adults and children. We're not going to go over pediatric apnea or other forms of adult apnea. We're going to talk about the common form, which is obstructive sleep apnea, OSA. And in this picture, you can see that the tongue and the soft tissues, including the uvula here, and this portion of the tongue, are so large that when the person's sleeping, they're falling backwards, pressing into that open airway and blocking it. So the person might be trying to breathe through their nose, and air might be flowing downward to the back passages of the nasal area and the sinuses, but it's blocked. It just literally can't get down into your lungs. And then the person may or may not have their mouth open, or they might have their mouth open because they're having difficulty breathing. So they're trying their best, every single thing they can do to get some air into their lungs. And also that air coming in is blocked by the tongue, maybe by the uvula. If we're obese or overweight, it's possible that the skin and subcutaneous tissues is also thick with a fatty layer, subcutaneous fat, that's also playing a role in narrowing or closing the airway. So this airway is indeed obstructed. There are some methods that we can use once you're diagnosed with sleep apnea. And on the right here, you'll see that this is a pretty substantial mask that this man's having to use. He has to have a strap over the mouth area and a strap over his forehead to keep it on. And it's delivering what we call positive airway pressure, CPAP, continuous positive airway pressure. This can be manual, where you may have to change a setting on a machine, or it can be automated, where it might be between 5 and 15 centimeters of water of pressure. So the pressure is greater than the atmospheric pressure in the room, and it's going to push some of these fatty tissues aside and open the airway so the air can actually get into the lungs. Okay, so I've showed you some pictures that are very appropriate. Now I'm going to go over some information. And you can look at this information yourself. You can go to reputable websites like mayoclinic.com, WebMD, familydoctor.org. I encourage you to read, read, and read. Question everything. So the definition of sleep apnea is a sleep disorder characterized by pauses in breathing during sleep. These pauses can last for a few seconds to minutes and occur multiple times throughout the night. Usually the person themselves is not aware that they're actually having pauses in their respiration, but a person sleeping in the same room as them is definitely aware. They might hear the person chortling or struggling and then stop. And there's just no more breath. And this can go on for many seconds or, like I said, even minutes. So as I said earlier, we're going to talk about a common type of sleep apnea in this particular video, and that's called obstructive sleep apnea in adults. The most common type, where the airway becomes blocked by soft tissues in the throat, such as the tongue or even the tonsils. Central sleep apnea is another type of sleep apnea. That's when the brain fails to send signals to the breathing muscles, but we're not going to go over that today. We can go over that in another video. And there's also complex sleep apnea, which is a combination of obstructive and central. But let's go back to obstructive sleep apnea, OSA. So a family member or a person sleeping in the same room or even in the same apartment or house can hear very loud snoring. The person themselves may be excessively sleepy during the day. They may have difficulty concentrating. They might have headaches in the morning when they wake up. They might be irritable. They might have dry mouth because they might have to be forced to try to use their mouth to get air into their lungs, and that's drying out the mouth. They might have frequent urination at nighttime, and this occurs because they're awake very frequently, and then they have to empty their bladder. And then someone might be witnessing that they're actually pausing breathing during their sleep. The diagnosis has to be made with a sleep study, at least from my doctor point of view. I planned in my mind to give you a little bit of an aside on this video. If you suspect that you have sleep apnea and for some reason you don't have access to health insurance or to see a physician or to get that very intense sleep study, the diagnostic sleep study, please do something to intervene for yourself. You want to have a good, consistent intake of oxygen throughout the nighttime. So change your sleep position. Instead of laying on your back, where all the soft tissues in your mouth can just lay up against your airway, then lay on your side. Lay on your stomach, although laying on your stomach is not good for many other reasons. But try to do something proactive to make sure that you're getting oxygen in your body overnight. Room air oxygen. You don't have to get a tank or a separate source of oxygen. Room air oxygen is good. It's just that that air has to actually get into your lungs. So that's what you're trying to do. If you're overweight or obese and you know that you were sleeping well before you were overweight or obese, you weren't snoring much at all, then clearly you need to lose weight. So you should be working on that, eating healthy and exercising every day. And that will help. Make sure you see your doctor regularly. If need be, ask for an ENT referral, ear, nose, throat specialist, in case there's some extra tonsillar tissue, for example, or that uvula in the back of the throat is very large. And there are over-the-counter devices that you can put on your nose or other devices where they may help. So try to be proactive. But as I say in almost all my videos, make sure you have a relationship with a primary care provider, a primary care doctor, and let them know your symptoms and your suspicions. So a sleep study can be many different things. Typically, I'll order a diagnostic sleep study because Yes, I might have a suspicion for obstructive sleep apnea, but there are many different types of sleep disorders. So I want to be sure, is that person going into certain stages of sleep like they're supposed to? Is that person having interruptions at this stage of sleep, but not at this stage of sleep? So a diagnostic sleep study is ideal to know for sure what's going on. And it's not diagnostic unless the person has 6 hours of sleep in the sleep lab, at least a minimum of 6 hours to be analyzed. Nowadays, you can do a formal sleep study in home. I'm not going to be talking too much about that today, but at least you know that there are options. And then if you are lucky enough to have health insurance, have access to a primary care provider, and get the sleep study test ordered, then you know that you may or may not have to sleep in a sleep lab. And you'll have pads on your head, your heart, your arms and legs. Your brain will be measured, your heart will be measured, your oxygen will be measured. The sleep study is helpful if you think in your mind you don't want to have the very heavy, large apparatus every night. If you do end up having sleep apnea, there are other devices, including oral appliances, and sometimes dentists can help us with that. So you can actually ask your dentist too. Obviously, they know a great deal about the oral cavity. So there are oral appliances that can be custom made that fit over your teeth to prevent the airway from collapsing. Surgery may be an option, although I can tell you in the past 30, 40 years, we've gotten away from surgeries and we're moving more towards losing weight, conservative measures, supportive measures, and if need be, the CPAP mask. Lifestyle changes, I already mentioned it, but please lose weight. Quit smoking if you're smoking. Smoking is very detrimental to the airway passages. And avoid alcohol. Alcohol is a sedative and it will make the airway, the back of the airway collapse even more. And then any sedatives like prescription sedatives or even a high dose of Benadryl, for example, over the counter, those could be playing a role in worsening your symptoms. I'm not saying that you absolutely should not have prescription medications to help you sleep. But you do need to be aware that when you treat one problem, say insomnia, from a completely different cause, then the actual treatment of that problem could be causing a problem elsewhere. And that's so common in medicine. So that's why you need a primary care provider to keep track of all these pros and cons of every single intervention that we give you. And I did touch on this, and the expert on atrial fibrillation that I spoke to also touched on this quite a bit, that untreated sleep apnea can lead to serious health problems. So you really have to be proactive. If you have a suspicion, do all the things I've mentioned. So health problems from sleep apnea can include heart disease, stroke, diabetes. Interesting. High blood pressure and cognitive decline. So forgetfulness, judgment, not being quite right. So to prevent sleep apnea, maintain a healthy weight. Generally speaking, the body mass index should be 25 or less. I have a bit of nuance to give on that. I'll talk about that more with an obesity video. And you can calculate your body mass index just by using your smartphone or asking your doctor to calculate it for you. But you want a body mass index of 25 or less. Prevention also includes quit smoking. If you are not an active smoker yourself, I've talked about this in prior videos. If someone around you is smoking in a very close proximity and on a regular basis, then you're actually a smoker. We call that passive smoker. So you want to stay away from that type of exposure as well. You'll see on the internet, it'll say at the reputable sites that I told you about, it'll say limit alcohol consumption. But as I've said many times in other videos, I would say drink no alcohol whatsoever. Zero, zero, zero alcohol. And treat underlying conditions such as enlarged tonsils or adenoids. Sleep on your side or stomach instead of your back. But as I said, sleeping on your stomach can have some problems too. And some people, remember, I'm a senior specialist, and there can be a lot of aches and pains, arthritis, bursitis, tendonitis, injuries, and sometimes people can't sleep on one side or the other. So you definitely want to consult your primary care provider and get a holistic or overall plan. So I talked about the diagnosis. Let me go back and show you some images. Okay, so I've lost that a second. So I'm going to take a moment to discuss my books. My Here we go. I found the images. Let me share for you. Okay, so let's share this one. Okay, so I showed you this pretty large apparatus earlier. I think I showed you an example of a person actually using the CPAP mask and the tubing, and there's the machine. In the old days, you just had the knob, and then you'd have to put it to a setting that you were told you need from having had the titration study. That's another night at the sleep lab where they had to figure out exactly what your settings were and what mask worked well for your face, head, and neck. Um, but nowadays it is a bit simpler. You don't have to figure things out or put your setting yourself. There is more of an automated machine that is available. Some people need humidification in this tubing because their mouth and oral cavity gets so dry. Some people actually need oxygen piggybacking on this tubing because their oxygen is so low. A good example might be someone who suffers from COPD, or someone who suffers from chronic respiratory failure or heart failure. There are many different chronic conditions where your oxygen level is too low. So sleep apnea might be one reason why you have to have a large apparatus like this, but then you might have other conditions where it would be helpful if you had a consistent amount of oxygen during the night. And then you also might need an oxygen supply just because of those other health problems. And I'm just going to go over the passages one more time to end this video. So you'll notice that if you're sleeping, say on your back, and you don't have any sort of abnormality with your soft tissues in your head and neck, and you're the ideal body weight, the air is more than likely going to flow through the nose without impedance and come down in through the trachea. And then the mouth may or may not be open, and the air will flow without impedance as well. And then if you look over to the right here, obstructed airway, this is where even though you're breathing through your nose, it just can't get past the soft tissues. And then you might have your mouth open and it also just can't get past. So you might not breathe. Okay, so this is the basics with the sleep apnea. This is the end of the medical information. I'm going to switch to spiritual information. If you do not want to see this portion of the video, this is your time to click away. But first, please do like and subscribe. So for spiritual information, I tend to tell the viewers that I am a devout Christian. I am not trying to proselytize, but I have noticed through almost 25 years of medical practice that those patients who have a spiritual discipline or religion or even close family ties, something in their life that's bigger than their own personal story, they tend to do better in terms of health outcomes. And the literature does bear that out to some degree. So my personal opinion is that it's very important to be saved. And I have mentioned to you before that I have written a book. My first book is about theology and salvation. And I do think that it is important to be saved. And I also think that you really already are saved. You just have to realize it. And that's where having a spiritual practice or a religion, especially a relationship with Jesus Christ, will help you realize who you are and help you realize that salvation experience much sooner, perhaps, than would otherwise be. And everything opens up for you after you're saved. And my second book is a book just to entertain. It does have elements of Christianity in it and Hinduism. I'm just going to show that to you. Both of my books are available on Amazon. So it does have one of the characters in the book is Oppenheimer. I promise you I started writing this before the movie came out. And so anyway, this is the second book to entertain. I feel like it's really good if you're just reading a book at night or on vacation. And it's an adult book, though. It does have adult content. I am working on a third book. It will also be to entertain. And then one of the videos I told you about a website that I liked, actually a couple of videos. And this one is BibleProject.com. You can put the app on your phone and you kind of look for this Bible Project. And they have fantastic videos, very well done. The artistry is beautiful. The information is solid. And that will be good information to learn about the Bible as well. So this is the end of the sleep apnea video. I hope you've enjoyed it. If you want me to speak about any other topics, please do let me know.